A ventilator is a form of life support, and what it does is it essentially takes over breathing for a patient who can't do it for themselves. So there's many different reasons a patient might be on a ventilator. They might be going in for surgery and have to be put asleep so that they don't feel what's happening in the surgery. They might be critically ill and have to be placed into a medically induced coma. And then they might have lost the ability to breathe on their own. What it does is we attach the back of the ventilator to air and oxygen, and it pushes air into the patient's lungs. If you're looking at the ventilator and you see two different colors of tubes, the blue tube is what delivers the breath from the ventilator into the patient, and the white tube is what delivers the breath from the patient back to the ventilator. There's lots of information that we can get just from the screen of our ventilator. We can tell if a patient has restrictive lung disease, such as pulmonary fibrosis, or even post-COVID lungs are very tight and restrictive. The ventilators will also tell us if the patients have perfectly healthy lungs, and if they might just be put to sleep for their surgery.